This 26-year-old patient was referred to me for endodontic treatment of tooth number 13. According to the patient, a few months ago, she had a cavity and her dentist cleaned out the decay and told her that she needed a crown. Tooth was crowned. And patient says after the crown, tooth never felt right. Then tooth started to bother her. And then she also noticed a little blister above the tooth on her gum. So she saw her dentist, and her dentist told her that she needed the root canal, and she referred her to us. So as you can see here, porcelain crown on the tooth. Tooth had Miller class 1 plus mobility, percussion, palpation tender. There was a small buccal parulus and sinus tract associated with the tooth. Probings 1 to 2 millimeters all around. And again, you can see the porcelain crown and a periapical lucency. Here's the small buccal parulus and sinus tract that's associated with the tooth. And that's the tooth here. Discuss options with the patient, and she wanted to try to save the tooth. And that's what we did today. In one appointment, went through the porcelain crown, necrotic, of course, pulp, cleaned it all out, 6% sodium hypochlorite, sonic and ultrasonic activation. We already knew the apical diameter was going to be 50 and more, and it turned out to be 50, so take a look. Placed an MTA plug, that's MTA. Extrusion is okay, as long as it's not in anatomically sensitive areas, of course, but that is fine. Extrusion is fine. I've seen clinicians use MTA as bone graft material, so white MTA, because the apical diameter was large, and if I ever need to do an apico, now my apico is much easier, much faster, much quicker. Followed by gutta percha and sealer. We temporize the tooth and refer the patient back to her dentist for the permanent restoration. She doesn't really even need a new crown. I went through the porcelain crown turned out to be fine. So we scheduled the patient. Hopefully she'll come back in 6 months, and I can post the progress of this treatment, one appointment treatment for you guys. But as you can see, everything went beautifully here. And I have videos on how I place these MTA plugs. You can go to my Instagram, TikTok, or YouTube and watch those videos.